do test results impact care?
Yeah. So, once the doctor has confirmed it is small cell lung cancer and they have confirmed what stage it is at, and what I mean by staging is that it could be either a limited stage disease, which is an early stage small cell, or it could be an extensive stage small cell. And the treatment for those two are quite different. So if it is an early stage or a limited stage, patients are usually treated with chemoradiation. And if it is an extensive stage or a metastatic small cell, then patients are usually given the standard of care, which is chemotherapy in combination with immunotherapy, which is an antibody against PD-L1.
You're talking about treatment options that are currently available for small cell lung cancer. What about targeted therapies?
There aren't very many therapeutic strategies that are targeted therapies as we speak, like we hear for non-small cell lung cancer. So currently, as I mentioned, the frontline treatment with small cell lung cancer is with chemotherapy and immunotherapy, and with the maintenance immunotherapy alone. And once the patient relapses, which often is the case, almost all patients actually have resistance to the frontline chemo IO at some point in time. Once they have a relapsed disease, the second line approved therapy till now is with either topotecan or irinotecan, which are topoisomerase inhibitors, or with lurbinectedin, which is in the second line. So when it comes to targeted therapies, so far we have seen, the conventional way how we think about EGFR inhibitors or KRAS inhibitors. It hasn't been the case so far with small cell lung cancer. It's a very limited in the current approved setting, but there are many clinical trials that are investigating several targeted therapy that are either targeting, and I can speak about that more as I talk about research strategy, but there are many targeted agents that are targeting surface targets like DLL3, B7H3, or CES6. And there are other targets that are targeting things like DNA damage repair proteins or epigenetic regulators like LSD1. But so far, in the approved setting, it is quite limited.
Mm-hmm. When we look at what therapies are available, what treatment options are available, what are some typical side effects and how are they managed?
Yeah. So some of the major side effects that you see, especially with the frontline chemo IO, are very common, like you see with other cancer types also. It's usually myelosuppression. And I think it is prevented or it is managed by either dose reduction or treatment delays or treated with transfusion. And, there has been research that CDK4/6 inhibitor, trilaciclib, when treated in combination with chemotherapy, can bring down the side effects that we see with chemotherapy. And some of the immunotherapy-related adverse events includes pneumonitis, colitis, and they're usually treated with early steroids, with treatment withholding, and also even it could be leading to permanent discontinuation of the treatment if the adverse events are really severe. And those are mainly what we see with the chemo-IO regimen that is given up front.
Okay. What questions should someone be asking about their proposed treatment plan?
Right. So I think, of course, first is, what stage, and the treatment would depend upon the stage of small cell. And usually in the front line, everyone is given chemo-IO. So everyone is given chemotherapy and immunotherapy. It's a systemic therapy that's been given. But I think the patient should be asking the questions like, are there clinical trials available for me? Because there are multiple clinical trials right now in the front line and in the second line setting. So I think definitely the patient should ask about the clinical trials that they qualify for. In terms of contributing to research, I think, if there are options for them to either sign up for blood collection protocol or for tissue collection protocol, I think the patients should definitely enroll for that, because that really helps our research strategy. But in terms of treatment, I think they should ask about available clinical trials that they qualify for.
Well, let's turn to clinical trials then. Patient participation, of course, is essential to finding new and better treatments. What would you say to someone who's hesitant in participating in a clinical trial?
Yeah, I mean, that's often the theme because we hear about these novel drugs, they're in trials. For a disease that's that aggressive, I think once there is a relapse, I think clinical trials could be a very good option for patients. These are novel drugs that have come out from very robust research that we do in the lab, and they can often work quite a bit. So I think, of course, talk to your physicians, talk to them at length about whether you do qualify for it. But if there is a trial at the center that you're getting treated at, and if the doctor advises that, I think enrolling in a clinical trial could be a very good option for patients, especially in the aggressive setting where there are not many options available for patients. And as I mentioned here, research is my true north. I mean, all my lab does is understanding the biology of small cell, and it's extremely essential that we actually try to get the knowledge of the patient tumor. So if you have availability of contributing either in terms of tissue or blood to research, I think I would advise and I would encourage patients to definitely contribute to that.